So good day and welcome again to this video lecture series, and we're on our ninth. Okay, research should be eighth. Sorry for that. And ninth is records management. So records management is focusing on the competence of maintaining appropriate documentation and using proper or appropriate systems and staying within the legal bounds in the area or in your work. And this is also focusing on matters regarding privacy, patient's privacy. So records management, or in other words, this is like your documentation and filing, is also one of the responsibilities, one of the competencies of a nurse. Okay, so this is one of your future responsibilities, future competencies, or the one of the competencies you need to develop. Okay, this is a short one only. We, based on the same goal, we have 3 competencies. One is maintaining accurate and updated documentation of patient care. Okay, so the word here is updated. So every time, almost every shift, a patient's record should be updated with regards to the condition, with doctor's orders, with the treatment regimen, with the activities done to him or her, the situation, condition of the patient. So from time to time, you need to really update it until you endorse it to the incoming nurses. And this is also to track the progress or the progression of the condition of the patient. And when you do this, you usually write it in the chart. And remember that the chart is should be held with all privacy. Okay, the chart, though the information is from the patient, but the chart, the paper of the patient is owned by the hospital. Okay, it is owned by the hospital. It must not be seen. Especially the information must not be seen by any person outside the team, the healthcare team, unless it is really permitted by the hospital. For example, for case matters, really, even the significant others, the families, are ideally not allowed, okay, to see the information in the chart. Okay. Number 2, records outcome of patient care. So a nurse or the institution must utilize a record system. So this is to make the recordings, the documentations organized, systematic, well documented. So it's up to the, actually this is a policy that is from institution to institution. Okay, there are standards, but the practice is depending on the institution on how are they going to go about, or how are they going to have their record system. Okay? So later on, when you go to your REs, or later on when you go to your institution as a future nurse, you observe the system of recording, the system of documenting, okay, to better appreciate this one. And in your REs later, when you become second year, third year, fourth year, you'll be trained how to have a very good record system. And then third, observe legal imperatives in recording keeping. Okay, so when you say imperatives, this is like a directives. These are decree. These are compelling legal matters when it comes to record keeping that you should keep in mind, always keep in mind. Okay, so what are these legal imperatives? It's stated in these indicators. One is you should observe confidentiality and privacy of patients' records. That's a mandate. Okay, not only the patient's records, but also matters that you usually see in the hospital setting, for example, should be held confidential and of privacy. Maintains an organized system of filing and keeping patients' records in a designated area. Okay, there must be a safe place in the ward, in the department of discharge of this information and of the institution, whether you're in the community or hospital setting. There must be a record section that not anyone, not everybody or anyone can access it immediately. Okay? Then refrain from releasing records and other information without proper authority. Just like what I've mentioned earlier, there must be a permission coming from the proper authority of an institution to release some, okay, but not usually all information regarding the patient, but it's also case-to-case basis. Okay, so for example, what is happening right now um, during this pandemic times, we release travel. Uh, I mean, we see or read in the mass media that names are not released unless they self uh, admit it or openly publicize that they are a COVID patient. So names are really held confidential. They use codes, but they release travel histories. They do not even release addresses, but only the place, the province, the city that they live in. So that's confidentiality. Okay, and this is also expected from us as a future nurse. Upheld confidentiality, privacy of patients. Okay, that's also one way of respecting their dignity. Okay, usually information are only divulged for some instances, like for example, public safety. Second is needed for legal matters, especially in court, and some others is with the permission, but not really so much with the permission of the patient. Okay? It has to undergo still process until the proper authorities of the institution will allow it. Okay? So that is records management, key area of responsibility. So again, upheld privacy, upheld confidentiality as a future nurse. And now, we will not forget that. Okay? So, we're down to our last two key areas of responsibilities. Thank you for watching. Don't forget to subscribe. And again, this is your email, your online nurse educator. See ya.